Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas. Hey everybody, it's Dr. Reiser. We're going to continue on with Thyroid Awareness Week for our Whiteboard Wednesday today. We talked a little bit about it in the beginning of the month, but now we're going to come back to it because we're going to discuss a few things today, namely lab values that you should be going over with your doctor to actually see optimum thyroid function. We're going into what you can do as far as nutrients to support your thyroid if you have hypothyroidism. And then at the very end of this, we're going to go over one test that you need to make sure you see if you do have Hashimoto's disease. So to begin with this, really, we want to talk about Hashimoto's because that's mainly what we're discussing in this video. And that's just due to the fact that 90% of people with hypothyroidism suffer from Hashimoto's disease. So Hashimoto's disease, we should be all well aware of it, an autoimmune disease that attacks the thyroid and then essentially the effect of it becoming a slowed down thyroid and inability of the thyroid hormones to do their job, specifically T3. So there's one thing that does scare me about Hashimoto's, well, there's a couple things. Number one is that really your conventional medicine side refuses to acknowledge that this is even a problem, even though 90% of individuals have it. And number two is the things that come along with Hashimoto's disease. So obviously we know that it affects the thyroid. We know that it affects the thyroid hormones, and we get symptoms of thyroid weight gain and all these other things that people complain of that come to me. But one of the things I always tell people about Hashimoto's disease is that it can lead to other issues. And we're looking behind me on this whiteboard, other disease processes that can come from just having Hashimoto's. Typically you see this autoimmune cascade occur where you're starting with Hashimoto's, and then if we turn around here and look, you're ending up with things like celiac, so we have issues with gluten. You end up with neurological issues, brain fog, memory. That's why a lot of these people with Hashimoto's disease are having these cognition issues. We have pernicious anemia. They're finding that people with Hashimoto's, another autoimmune issue will occur where you're not utilizing intrinsic factor to help with B12 absorption. And then finally, glutamic acid decarboxylase. Basically what this means is you're having an autoimmune reaction to this enzyme, and that you will now have anxiety, you'll have mood issues, and that's kind of the cocktail you'll see with a lot of Hashimoto's patients, but it will be actually other diseases manifesting themselves. So if you're looking at these are the top four, and that's why they call it a polyendocrine autoimmune pattern. So multiple endocrine functions are affected. So let's get down to brass tacks here about Hashimoto's. The number one thing I always tell people is let's look at your lab ranges. Let's say you already know you have Hashimoto's, maybe you're on medication, maybe you're seeing an FM doctor like me. We want to make sure you get into the optimum ranges here. So let's erase this. And the first thing we're going to pop up that you need to make sure you look at is your TSH, thyroid stimulating hormone. I'm going to get a different marker here. And your TSH generally should be 1.8 to 3. That's where we want to see that. 3.0 you'll probably see on the lab range. But thyroid stimulating hormone needs to be within there to be considered high functioning or perfect as far as what the pituitary is putting out. A lot of times though, I'll even see this go down to about 0.9 and still be okay. But I get worried if it's over 3. That's where we want to see your TSH though, is 1.8 to 3. Next thing we're looking at is your total T4. You want to see that ideally between 6 to 12 as a functional range. A lot of times I'll see patients start to squeak below 6 and be in the 5 range. You need to push that T4 so that it can convert into T3. So what is the total T3 range that we need to see? Total T3, 100 to 180. Now lab ranges for this are going to be all the way down at 71 to 180. That's a really large lab range. But what you'll see in many individuals, and obviously mostly women, is once we drop below that 100, even though it's considered normal in your lab range, you're going to have symptoms of hypothyroidism and Hashimoto's disease. But there's another test, obviously free T3 is what we really need to see. That's the metabolically active form of T3 when it gets cleaved. That's the T3 that goes out and does all the jobs for the thyroid. So what should your free T3 be? Free T3. I like to see it 3.0 up to that 4.4. And sometimes you can even get it a little higher than that. There's some people that function better If it's over even the functional range or the lab range, I'm going to tag Elle Russ in this. Great book if you haven't already read it. We'll put a link to it as well, but she even talks about how even sometimes she felt better if she had a T3 that was even higher than you should see it on the lab range. But the one thing I always tell patients is if your free T3 is not over that 3 mark, that's at least where you want to get it to have a shot at this to feeling better. So those are the lab ranges you want to see. Make sure your doctor understands that. If he does not or she does not, try to find somebody that really understands functional lab ranges, okay? So next thing we're going to look at are the things that you can start to take to help out with your Hashimoto's. And these are things that are pretty generic. And as always, when I talk about generic information, watch yourself. We had a post yesterday that we talked about Th1 and Th2 dominance with Hashimoto's, how Hashimoto's disease can become a dominance of one side of the immune system over the other. And there's certain herbals and foods that can trigger these things. And for instance, green tea is one thing that pushes Th2 dominance. And a lot of people with Hashimoto's have a Th2 dominance. Green tea can make them worse. So this is generic advice. These are things where you can get started, but obviously work with somebody such as myself to help you balance these out and see if you actually do need these, especially the dosages for these, okay? So first thing we need to make sure that if you have an autoimmune disease, and specifically Hashimoto's disease, is vitamin D. Ask your practitioner to dose you appropriately. It's different for every individual. We want to see some zinc in here. We want to see some vitamin A in here. You can even throw some vitamin E in there. We want to make sure we've got selenium. This is very important. Selenium out of all these is one thing that's going to lower your TPO antibodies. So this is one that they've shown time and time again. You take your selenium, not only is it going to convert your T4 into your T3, it is going to lower your antibodies, and that's what you want. And then last but not least here, we want to do some omegas. And this is going to be from any kind of source, but hopefully you're doing some cold water fish here. And that is that. That's pretty much where you can get started with this. But really, you got to find the triggers. And that's going to be with food sensitivities and doing a stool analysis. And that leads me to my very last topic here. What is the one test that you need to see the results of if you have Hashimoto's, because they're seeing it as a trigger for most people with this disease, okay? And this is going to be something that we can do for you here at the office. A lot of functional medicine practitioners can do for you. I trust this through a stool analysis, but you can also do it through your doctor. But you need to figure out if you have this, and we've gone over it before. And that is H. pylori. Okay, so we talked about H. pylori before in the past, and this is Helicobacter pylori. It's something that infects the intestine and the stomach. It can cause ulcers, it can cause gastric reflux and GERD, but they're seeing that there's a specific strain of this, a virulent strain that is linked to Hashimoto's or even the triggering of the disease. And I will see this a lot in my patients that have either an autoimmune disease or Hashimoto's disease. So if we find this in you, if you have Hashimoto's disease, this is the first thing that we have to eradicate. And you can do this with herbals. Now, not all herbals are going to kill this thing in some severe cases, so we may actually have to do some heavy antibiotics. So this is something you have to know. You need to see this if you have Hashimoto's disease. And a lot of you out there have Hashimoto's that is under control and you're figuring it out with diet. But if you don't have this fixed, it can creep up and bite you. So make sure you look at this, figure out if you have it, get rid of it, and that will save you, because it's going to, once this is gone, it's not going to push that immune reaction. This is, and what they're showing is it's similar to your thyroid enzymes that convert. So if it's similar as far as a DNA structure, your body can kind of confuse the two, and it will start to attack this as if, it's a major infection, which it is. And that will also make you attack your thyroid enzymes, okay? So thyroglobulin specifically. So this is important. Find this out. We can do it here at the office. Very easy stool test. It'll show us all your other triggers for Hashimoto's as well. But take those tips. Find a good lab range get optimal lab range for your thyroid. Make sure you're doing that. Be aware that Hashimoto's can cause other diseases. It's a polyendocrine issue. And this guy right here, H. pylori, find out if you have it. Because if you have it, you got to get rid of it, okay? If you need any more tips about thyroid, scroll down through our Instagram or our Facebook. There's plenty of other videos, and be on the lookout for more thyroid posts this month, and we'll keep